In 2006, the state of Massachusetts passed a health care reform bill, universal health care. And to be able to talk about that plan and what's happened, I need to give you a summary of that. First, individuals and families can buy insurance from one of, I think, 7 different private insurers that are available on a healthcare exchange. The rates and coverage are determined by the state in an open bidding process. It is Section 125 eligible, so it's paid for with pre-tax dollars with help of your employer. It's portable, and anyone can buy insurance regardless of healthcare status. 2, there is a mandate. So anybody, nearly everyone, I think there's a religious exception, nearly everyone has to buy it. Nearly every employer has to offer it, and it is enforced by the state revenue office. So either you pay a fine, or if you had a tax refund coming, you're actually not having one coming. There is a subsidy. People with incomes below 3 times the federal poverty level get a sliding scale subsidy. Massachusetts just had the idea that there's always going to be a subsidy somewhere. Why not give the money to the individual to buy insurance rather than to some huge organization or hospital to provide the uncompensated care? Well, what's happened since then? Well, they actually have come quite close to their idea of universal health care. An enormous number of people signed up, about 400,000 more than they expected. More employers signed up than they expected. Actually, that goes counter to the national trend. But it created a huge doctor shortage, especially primary care. Primary care physicians are your first line of defense. They're the guys who can quarterback or coordinate your care with other doctors. So much so that some people who couldn't handle the wait times for a doctor's office, or people who couldn't even find the doctor who was accepting new patients, got their service, their treatment at the emergency room, kind of like before. And of course, costs have spiraled. The majority of the newbies, the 400,000 who signed up, needed a subsidy. So costs have gone up about 42% since the inception of the program. That meant the state had to shake the tree, increase fees, taxes, payments, premiums, and co-payments. But here is the philosophical rub. The state can shake the tree only so much. At a certain point, the costs have got to come down. State of Massachusetts is going to start out on that path by trying to change the fee-for-service, aka the quantity over quality mindset that is all over every government healthcare program out there. I sincerely wish them luck. If that doesn't work, and chances are it won't, they will have to impose spending caps or price controls. Maybe something like capitation, where the state gives the doctor, $100 per patient and calls it a day. This is what the Wall Street Journal has called the Bay State bait and switch. Bait citizens with blue sky promises of free health care and then impose rationing. Rationing, which if politicians had been honest about from the get-go, programs like this never would have seen the light of day. I think that's going to happen on the federal level, and it is that dishonesty of our elected representatives about rationing that I think I dislike almost as much as the loss of liberty.